This video is an introduction to the fourth and final phase of the LIFE methodology, evaluate. The LIFE methodology for agile co-creation of robotic solutions for older adults consists of 4 phases: listen, innovate, field test, and evaluate. In this video, we look into the final evaluation and the latest check of this method, the market readiness check. The evaluate phase contains a lot of research, a large end experiment, a market assessment, and a sustainability assessment. The end experiment is the final big experimentation that you need to demonstrate that the robotic solution you have developed brings value to the market and brings value to the user. Of course, the experiment starts with a research question, and this research question can contain different domains and different aspects, but usually you are also interested, as one of the most important things, in outcomes of the user. The second step of the end experiment is to choose the experimental design. And you have to think critically if the design that you choose can really answer the research question. Another thing to look into is the level of evidence you want to achieve. And that has a consequence for the sample size and whether or not you have a control group in your experimental design. Of course, you are also limited by certain things, for example, the resources that you have, the time that you have, and maybe also the number of robots that you have. So you have to think of, is the experimental design also executable, given these constraints that I have? Third step of the end experiment is to specify the criteria for the selection of end users. That means criteria for inclusion and, equally important, criteria for exclusion. That can be have to do with the mental state, the health state of the older adults you want to introduce, can have to do with the type of role that the formal caregiver has, so their profession, and for informal caregivers it can be the frequency of interaction that they have with the older adult. All these things are relevant when deciding upon who you're going to select. Then the fourth phase is the definition of your dimensions. Those are defined based on your research question, and for each dimension you have to think of what will be the indicators that I want to really collect my data on, and how am I going to do that? So with what kind of aspects am I interested in? Some examples. If the value of your robotic solution and you want to demonstrate some sort of social value, then a dimension that could be relevant is social effectiveness. One of the indicators of social effectiveness could be loneliness, and you can operationalize that in different ways: subjective loneliness or objective social activity. Why would you be interested in social value? Well, that can be because you want to evaluate one of the functionalities of your robot, the remote communication. Another type of value could be functional value, so that the robot helps solve an issue. For example, related to the functionality of fall detection. The dimension that you are actually measuring in your experiment is safety, and falls is an indicator for that. You can operationalize the dimension safety, looking at perceived safety, but also very practical, the number of times an older adult falls in the home. Once you've done this exercise of defining your dimensions, your indicators, and your operationalization of those indicators, you can develop your research instruments. So you look into preferably validated instruments to measure aspects such as loneliness or social activity or perceived safety. There are many validated questionnaires around, and there are also in qualitative research, some examples of topic lists and questions you can ask your respondents in your experimentation. And maybe another research instrument is an actual calculation of how often things happen. And maybe the robot can help you with that data collection. We are already at step 6, that is the construction and giving the training. In our experience, giving individual training to older adults when they get a robot in their home for the experimentation is very important, because you can better assure them and you can better explain at their own pace, and you probably also have to visit them several times. Of course, you also have to adjust your training materials to the other target groups that are part of your experiment, the formal caregivers, the informal caregivers. Then step 7 is the actual experiment, where the robot is in the home of an older adult or is used in a care facility. And of course, remember that the duration of the experimentation is has consequences for the type of measures, the type of outcomes that you can really measure. For example, impact on quality of life. You will need at least a few months of exposure to having the robot in the home. Then the 8th step of the end experiment is a validation of the analysis that you do on the data that you collect during the experiment. And that can be in the form of a focus group with some people that were involved in the experimentation, where you present your analysis and ask them for feedback and for anything that you might have missed. The end experiment is followed by a market assessment. This is done through a market survey, and you might need an organization that has experience with doing market surveys, that has access also to panels. And this market survey assesses the interest of end users, their intention to adopt or use the robot, motivations and barriers for this adoption, and different parameters of the business model. For example, if people would be willing to pay for it, and if so, what would be the ideal amount, and what would be the way of paying, for example, a monthly subscription. We recommend for a market survey a sample size of at least 300 adults, and if you do an international comparison, like we did, that means 300 older adults per country. We did then online questionnaire for this market survey that was efficient and pragmatic and economical. However, you should consider bias in the older age group, that means 75 plus, because they are underrepresented in many panels that are used for market surveys. On the other hand, the big plus of doing an online questionnaire is that you're able to not only describe the robot that you're doing the survey about, but that you can also integrate a small demo video, because that gives a better impression of what the robot is able to do. The third research activity of the evaluate phase is a sustainability assessment. The goal of that is to find out what is needed to implement the robotic solution in the market. You use the input from the end experiment and the market assessment for the sustainability assessment. You will need expertise from your own research group, but maybe also from others, experts on legal issues, experts on financial issues and business models. And one of the ways to discuss this is to organize, again, focus groups. In these focus groups, we do the assessment, the same assessment, but more in depth as we did in the third phase, in the pre-experiment phase. We discuss with the experts and with the people that were involved in the project the outcomes achieved, and for that you need the results of the end experiment. Also the user perception. comes from that same experimentation, but also from your market assessment. Technical aspects. This is the moment when you have to think if your robot is really ready for the market, or if the end experiment gave you some homework to further improve the robot. Economic aspects. That would be the business model or the cost effectiveness. And so for that you need to investigate what are people willing to pay, what kind of subsidies are there, can we demonstrate in some way, for example with the data from our end experiment, that we can save time of healthcare staff, for example, if the robot is used intensively. Organizational aspects. That is about what is needed to really implement these robots in healthcare, because also the roles and responsibilities of care professionals will change because of using a robot, and it has to be part of a process if you really want it to be used and not to be neglected. Last aspect to think about is sociocultural, ethical and legal aspects. There might still be some issues about privacy or about the use of the robot in a medical context, which requires that it is has been accepted and been accredited as a medical device. Might also be other legal questions. So what we found out is that talking about a business model is a bit easier if the robotic services that you have developed are also of interest for a care organization. For example, if they can really see that this not only brings value for their clients, but also reduces staff time, for example. And then they will be more motivated to look for ways of financing it. And that can be through an e-health subsidy program or a silver economy program. Looking into these topics is very important for making the next step, the entry to the market. So organize as many of these focus groups and sessions as you need to give a satisfying answer to all the questions that you have. So don't rush this assessment. The assessment gives the input for checkpoint number 5, the final check of the LIFE methodology, the market readiness check. So here you ask yourself critically, given the results of this last evaluate phase, is the robot ready for the market? And if so, or if not, which work is needed on each domain? And who is responsible for that? So the sustainability assessment gives you really the input to perform this market readiness check. To sum up, the evaluate phase is the final evaluations. This contains 3 activities. The end experiment, which is a thorough assessment of the value of the robotic solution under real-life conditions in a large experiment. The market assessment, where we investigate the potential market through a market survey. And the sustainability assessment, where we critically look at what is needed for a sustainable entry to the market and implementation. Here, different domains are relevant: outcomes, user perception, technical aspects, economic aspects, organizational aspects, and sociocultural, ethical, and legal aspects. The final activity of the LIFE methodology is checkpoint number 5, the market readiness check. Is the robot ready on all domains to enter the market, and what work is still needed and by whom? The full methodology is described in the LIFE Methodology Handbook, which you can find on the project's website. This handbook and these videos have been developed as part of the ACRA project, a research and innovation action funded by Horizon 2020 and NICT. Thanks for watching.